the World Health Organization country representative, Dr. Lemo, the principal, Makerere University College of Sciences, Professor Nelson Swankambo, the keynote speaker, Dr. Erika, the president, Professor Sarah Chiguli, and members of the Executive Committee of the Eastern Africa Health Professionals Educators Association, distinguished delegates, ladies and gentlemen, I recognize each one of you. You are most welcome. I feel greatly honored to be part of the second annual conference of the Eastern Africa Health Professionals Educators Association, which the Makerere University College of Sciences is privileged to co-host. I commend the principal, College of Sciences, and the local organizing committee in Uganda, as well as the entire executive committee of the association. I do welcome all delegates to this conference, and I appreciate the association for the confidence placed in Makerere University and our country to host you this week. In a special way, I do welcome the World Health Organization's country representative, Dr. Lemo. Thank you very much for sparing time to be with us. Allow me also to welcome and thank the keynote speaker, who is going to address us on the theme, Strengthening Systems for its Professionals' Education. This is an important subject aiming at transforming the education and the training of health professionals of all cadres. It is true that there is a gap in the system for training and education of health professionals in Eastern Africa. In my view, there are a number of causes for this gap. The inequity in the admission criteria of students to health professionals institutions, the inappropriate curricula, which at times does not address the health needs of the population, inappropriate methods of training and education, inadequate learning environment in terms of space, place, structure, equipment, and other learning resources, inadequate numbers and competency of as a professional educators in promoting student learning, inadequate opportunities for continuous professional development of the faculty, to mention but a few. It is therefore a challenge for all the member institutions and individuals of this association to come up with appropriate innovative methods of training health professionals. Institutions, governments, development partners, communities, and all stakeholders should come up with policies and strategies that will lead to equity in admission of students to health professions programs. Ladies and gentlemen, in addition, there should be a recruitment of adequate numbers of well-qualified and highly motivated staff. Retention of faculty is another very important issue we must address through improvement of terms and conditions of service, enhancement of their working environment, and supporting faculty to develop and progress in their careers. Faculty should be encouraged to undertake research that will provide evidence for innovations which will work in our region. I do believe that health has to be integrated into the whole process of promoting and sustaining high levels of human development. One of the critical success factors towards the attainment of this objective is to strengthen the systems for training and education for health professionals. I must, however, emphasize the importance of involving all stakeholders in strengthening systems for education of health professionals. I'm happy to note that this association provides an important opportunity and platform for all individuals, institutions, and other stakeholders involved in education of health professionals to collaborate, cooperate, plan, and implement strategies that will improve the competency of educators. Many universities and other professionals training institutions in all countries in Eastern Africa are actively participating in the association, and the educators of doctors, nurses, and other health professionals are working together to achieve the same goal. I wish to congratulate the College of Health Sciences, Makerere University, for taking the lead in the thinking and the training of health professions in Uganda and rising to the challenge of spearheading the transformation of training and education of health professionals in Uganda by implementing innovative methods of education, including competency-based education, problem-based learning, and community-based education and service. I note from your busy program that you will be deliberating on a wide range of topical issues in strengthening systems for the professional education. Topics include competence-based education, innovative method of teaching and learning, community-based education and learning, service learning, e-learning, students assessment, mentorship, continuous professional development, quality assurance, among others. I believe that the deliberations will come up with solutions that will move the field of health education forward and lead to improvement in each of the individuals and institutions present. Ladies and gentlemen, in conclusion, allow me to thank those who have contributed to the organization, funding, and the administration of this conference, which I trust will be successful in achieving its intended objectives. Special thanks go to delegates who have traveled from far and near to attend this conference. Once again, allow me to thank the World Health Organization representative Kampala for gracing this occasion, and it's now my pleasure and honor to invite Dr. Lemu to come and address us. I thank you.